Before knowing abnormal things in X-rays in ENT, first know the normal things. This is a X-ray skull anterior-posterior view. I won't read the landmarks, so you should read by yourself. X-ray skull anterior-posterior view. This is the X-ray of the skull which is of lateral view. Okay, you can see sphenoid air sinus, mastoid air sinus, and condyle of the mandible. X-ray skull lateral view. You can see outer table and inner table of the cranium and external acoustic meatus. This is X-ray skull mastoid view. So you know temporal bone, there are various views like Law's view, Schuller's view, Stenver's view, Towne's view, transorbital view, and submentovertical view. Okay, Schuller's view is one of the view. This is important one. X-ray skull lateral view showing nearer one. You can see here. This is sella turcica where pituitary gland will be present. Remaining maxillary sinus and remaining you all know. This is X-ray of the skull PA, that is Cadwell's view of paranasal sinus. You already know paranasal sinuses have only three views: Waters view, Cadwell's view, and lateral view. Cadwell's view is also known as occipitofrontal view. Means you go and stand in front of a wall, attach your nose and forehead to the wall simultaneously. Attach your nose and forehead to the wall. The view which you will get is Cadwell's view. Landmarks, read by yourself. Next, this is X-ray of the skull, Waters view. Waters view, it is a view which is taken to see the paranasal sinuses, and this is also known as occipitomental view or nose chin position. Means go stand in front of a wall, attach your nose and chin to the wall. The view which you will get is Waters view. So majorly you can see paranasal sinuses here: maxillary, frontal, and sphenoid sinus. Sphenoid sinus is seen only when the mouth of the person is open. Okay, sphenoid sinus is seen inside of the mouth. This is something reverse water view. This is Towne's view. Towne's view is 30-degree fronto-occipital view which is taken from the back side. Okay. This is X-ray skull submentovertical view. It is also known as basal view. This is X-ray of the skull showing base of the skull. Okay. This is X-ray of the skull lateral view. Okay. This is most commonly taken for nasal bone fractures. Okay. In the examination hall, the reading of the X-ray is done in this format. First, we should tell plane or contrast. In contrast, dye is used. Next, we should tell the region. Region for like mastoid process, paranasal sinus, soft tissue neck. Next, we should tell the view, that is AP view, PA view, lateral view, or lateral oblique view. Next is anatomical landmarks, if any major anatomical landmarks seen. Pathological findings if present. Next is the diagnosis. This is the X-ray image of a lateral X-ray of the skull. You can see sclerotic mastoid. In sclerotic mastoid, there is absence of mastoid cells except the mastoid antrum, okay, which is seen smaller in size. Next is it is seen in chronic supraortic otitis media. Next is otitis media with effusion and tubotympanic disease. This is a X-ray image showing cholesteatoma erosion. Okay, you can see here there is cholesteatoma here followed by radiolucency, that is bone erosion here. Okay, and again it is followed by dense sclerosis here. Okay, dense sclerosis of the bone. See properly. First there is central cholesteatoma, that is white mass surrounded by radiolucency, and around it has a sclerosis of the bone. This is cholesteatoma erosion. These are the anatomical landmarks which you should know when lateral X-ray of the skull is taken. Okay. Now coming to the X-ray of paranasal sinuses, you can see this is Waters view, which is also known as a nose chin view. Okay, nose and chin are attached, and the X-rays are thrown from behind. Okay, here you can see in this way, and the mouth is kept open, so you can see the sphenoid sinus. This is the X-ray. We will get to see the paranasal sinus. We can see maxillary antrum, we can see sphenoid sinus, we can see frontal sinus. Okay, this is Cadwell's view, in which nose and your forehead is attached simultaneously. Okay, what is the importance of paranasal sinus? Look for sinus opacity, should be more dense than the orbital opacity. Look for dome shaped opacity in sinus, that is maxillary antrum polyp or cyst. Bony opacity is osteoma. Next is look for any fracture, look for bone destruction or malignancy, look for radiopaque foreign body. Okay. Anatomical landmarks for paranasal sinus are boundaries of frontal sinus, boundaries of maxillary sinus, ethmoid air sinus, sphenoid sinus, medial wall of the orbit, that is lamina papyracea, which is a thin bone. Okay, and next is innominate line. This is the X-ray showing Waters view. Okay, AP, and here you can see right maxillary sinusitis. Okay, here there is some haziness in the right maxillary sinus. This is the structure visualized in the lateral view of the X-ray of the neck. Okay, here you can see base of the tongue, epiglottis, hyoid bone, thyroid and cricoid cartilages, area epiglottic folds, subglottic trachea, prevertebral soft tissue, vertebral column, that is cervical vertebrae are seen. Next is the soft palate. This is a plain X-ray of the lateral view of the neck, which shows there is increase in the size of the epiglottis, that it may be thumb sign. It is called thumb sign. It is seen in acute epiglottitis. Okay, you should know what is the etiology, clinical features, and the treatment of acute epiglottitis. Okay. So here in this X-ray, you can see there is submandibular salivary calculus. Okay, where it is here. Okay, submandibular salivary calculus. So most important question they will ask about this is how will you take this X-ray? Okay. Here you can see, here is an image. There you will bite that metal plate in your mouth, and X-rays are thrown from above. Okay, so X-rays are thrown perpendicularly. Okay, which type of image do you want? If above, like from maxillary, if you should throw from above. If you want like some submandibular, like from below, you should throw like. Okay, so here you can see there is foreign body in the esophagus slit like, that is lateral view. Okay, so how to identify that is foreign body is in esophagus or trachea? If the foreign body is present just in front of the vertebra, okay, just in front of the vertebra, here the foreign body is present, then more likely it is to be present in esophagus. Okay, so here is a plain X-ray of the nasopharynx lateral view showing adenoids. Okay, adenoids which are seen most commonly in childs. Here is the adenoids. Okay, they will tell you to locate the adenoids. Next, this is a plain X-ray, that is bilateral nasal bone fracture. Whenever there is suspicion of nasal bone fracture, both right and left images are taken. Okay, so here you can see discontinuity. Okay, that is nasal bone fracture. Next, this is the plain X-ray Waters view of to see the paranasal sinus. So it is written here pan sinusitis, means all the sinuses are inflamed. So here you can see maxillary sinus and frontal sinus both are have some haziness is in, so it can be sinusitis. Okay, so don't tell like it is a plain X-ray showing pan sinusitis. Examiner may tell you like how are you telling it is a pan sinusitis. So just tell there is some like some haziness is in. Next, this is a right maxillary sinusitis, that is Waters view. You can see this side is more opaque than this side. Most commonly Waters view is must. Next, that is adenoids is must. Okay, this is the foreign body in the cricopharynx AP view. This is I am not sure the foreign body is present in cricopharynx only. It can be present in esophagus also. We should take one lateral view also to know this. Okay. Next, this is a rhinolith in the nose. Here you can see, here is the rhinolith. They will tell you to locate that. Okay, you should tell. Next, they will ask what is rhinolith and all. If you know, you can tell. Next is foreign body in the esophagus. Most commonly it can be the safety pin or it can be the coin. Okay, so how they are telling it is in esophagus? So here is the cervical vertebra, and just anterior to it present is a foreign body. Okay, then the foreign body is more likely to be in the esophagus. Next, this is bilateral view of the X-ray of the mastoid. Okay, sclerotic type. I have already told you in sclerosis what happened. The mastoid air cells are not seen, and the mastoid antrum, the size of the mastoid antrum is reduced. Okay, here is the external acoustic meatus. Behind there is sclerosis. Next, this is foreign body in the cricopharynx. Coin taken anteroposterior and lateral view. Okay. Here how they are telling it is in the cricopharynx. See, here is the vertebra and here is the foreign body. There is some space between it. Okay. That is esophagus. So that's why the foreign body is in the cricopharynx. And most likely the foreign body is enter into the trachea, like peanut entering into the right bronchus of the trachea. Okay. It can they can keep that also. Calculi and the submandibular gland, lateral view of the neck, they will tell you to locate. So here, submandibular calculi, submandibular salivary calculi, it can be obstructing the duct also. So next video will be instruments. We will see you in the next video, and I would like you to advise you to see all the X-rays which are present in your dhingra. Okay, they are very beautiful because let me show you. So I prefer you to go through the X-rays which are given in your dhingra textbook. Okay, they are the best ones because they have given like description below. So most liked one is this one. Okay, so here you can see hypodermic injection needle in the trachea in an adult, sudden gasp due to pat on the back of the unnoticed friend when he was busy picking the teeth. Okay, this you can see here hypodermic needle. With this the person was pricking his teeth and someone packed him in the back so that he swallowed that. Okay, this is the moya thing. There are so many other X-rays like lateral view of the neck showing calcification of the thyroid gland, that is papillary carcinoma, and here you can see achalasia cardia, ballooning of the esophagus because of lower esophagus sphincter is not relaxed. So here is a lateral view of the nose. You can see here is a nasal bone fracture. Okay, it is a discontinuity. So one of the most important question, difference between CT and MRI. Okay, CT is computed tomography. CT uses collimated X-ray beams. Okay, CT uses collimated X-ray beam, that is the radiation, and causes no noise. When these collimated X-ray beams are passed through a different tissue bodies, they are differentially absorbed. Okay, and the degree of attenuation of these beams is expressed in Hunson's field units. Okay, HOUNSFIELD units. Okay, CT is divided into -1000 to +1000. Okay, and water is being at the center. Okay, 0, water is 0, and fat lies in -80 to -100 fat. Okay, and bone lies in 100 to 400 plus. Okay, -1000 to +1000 Hunson's field units, and water is at 0, and -80 to -100 is fat, +100 to +400 is bone. Okay, I hope you are getting. Next, CT takes less time, it is less costly, takes axial slices which can be reconstructed into the coronal and sagittal views. Okay, and for taking the temporal bone view, the size of the slices are reduced. Okay, next, images can be taken in a bone and soft tissue windows to differentiate tissues. Okay, less motion artifacts, presence of metal implants is not a contraindication in CT scan. Risk of allergy to contrast material with which contains iodine. Next is no claustrophobia. Now coming to the MRI. MRI is also known as magnetic resonance imaging. Okay, it uses magnetic field and axial, coronal, sagittal, oblique, all the views can be taken. Okay, the magnetic field strength is 0.5 or 1.5 to 3 Tesla. Okay, so 1 Tesla is 10,000 Gauss. 1 Tesla is equal to 10k Gauss, GAUSS. Okay, remember. So MRI uses 0.5 or 1.5 to 3 Tesla. Okay. Next, higher the magnetic field created by the machine, better are the images. Okay. MRI does not use radiation. It is very noisy, time consuming, more costly. Okay. Takes original sizes in any planes. It can be T1 weighted or T2 weighted. Okay. Next, more motion artifacts. The patient likes to be need to lie in the same position for many times. Therefore, it is not done under children's and children's and like psychiatric patients. Okay. Next, presence of magnetic metal implants is a very severe contraindication in MRI. Okay, allergy to gadolinium contrast is rare, and claustrophobia in a closed machine. Okay, this is about CT and MRI. Okay. Now, what are the advantages of CT? It is images can be taken in one plane and reconstructed into the other plane also, and images are three-dimensional, which are more useful to identify fractures and neck tumors. Next, slices can be size of the slices can be reduced. That is a high resonance computed tomography. Next, spiral CT. To virtual endoscopy and tracheobronchoscopy. Next, we can use the contrast. You can see they have used iodine and gadolinium in MRI. Okay, and more precise for aspiration cytology. These are the uses of a CT scan. Now, what are the uses of MRI scan? There is no radiation hazard, and axial, coronal, sagittal, oblique panes can be obtained easily. It can be more done for soft tissues. Better than CT scan. Okay, tumor margins are better identified in MRI. But there are disadvantages of MRI because it is takes long time. It is not used for children and uncooperative patients. It is more expensive in CT scan, produces noise, and it is not useful in metallic implants like cardiac pacemaker, cochlear implants, intracranial aneurysm clips, and metallic foreign body in orbit. Okay, this is about CT and MRI. So that's it about the imaging techniques in the ENT. Okay, though I recommend you to go and read about dhinga textbook, which is about imaging techniques of the in ENT. Okay, which is very much useful for knowledge purpose. You can watch my video also. So see you in the next video. Until then, Jai Hind, Jai Bharat. Bye bye.